Women's health issues is a broad topic that encompasses societal, cultural, and biological effects on the individual woman. There are thousands of factors that affect the ways women develop, get sick, get well, interact, reproduce, age, and receive health care. There has been so much research done already regarding women's health, but still so much more to be done. Around the world, women continue to be less likely than men to receive health care, have opportunities for economic advancement, and to have political representation. We talk about everyone having equal rights to health care, but have yet to make it a reality. Global threats to women's health include poverty, malnutrition, HIV and AIDS, violence, and maternal morbidity and mortality, including disability, disease, or death related to pregnancy and childbirth. Getting access to clean water, nutritious food, adequate medical care, protection from violence, or clean, safe working conditions are things many of us take for granted, while millions of women around the world go without. Over the years, women have begun seeking out medical information on their own, becoming more informed on their health. This does not, however, solve the problem of access to health care. This is a serious and growing problem in our country. According to Alexander and LaRosa, in 2010, 19 million women aged 19 to 64 had no health insurance at all, and another 17 million were underinsured, so they had limitations on the care that they received. With the growing number of chronic conditions, this is a huge problem for us. Chronic diseases persist or progress slowly over a long period of time. Genetics and lifestyle factors such as diet, physical activity, and environmental exposures play the biggest roles. Management of these diseases plays a central part in the lives of these women. If we had adequate preventative methods and better treatment programs, I believe we could chip away at the number of women living with a single or multiple chronic diseases. Cardiovascular disease is the number one killer for women in the United States, so this should be a priority for us. Mental health is at least as important as physical health in order to create a meaningful life. Poor mental health can drastically interfere with our ability to function during simple day-to-day tasks. If it is such an important part of our lives, why don't we spend more time on it? Half of all Americans experience mental illness in their lifetime, but many do not seek medical treatment due to access to an appropriate physician, insurance coverage, or possibly just feeling embarrassed or too uncomfortable to talk about it. The best way to understand what the important women's health issues are is to actually ask people what they think about them.
My name is Mackenzie Backham, and I am an RN on a med-surg unit at Hudson Hospital. In my opinion, I feel mental health is one of the leading health issues for women. According to Recovery Across Mental Health, women are more likely to report symptoms and show signs compared to men. Because of these things, it leaves women stereotyped and could potentially result in women being not so willing to share their feelings. 1 in 4 women will require treatment for depression, whereas only 1 in 10 men will require treatment. Reasons in the difference are said to be unclear, however, are thought to be due to social and biological factors. Women are also twice as likely to experience anxiety. In my own work experience, I find this to be true. On the contrary, men tend to display their feelings of depression and or anxiety through an alcohol or drug addiction, this then leaving the male population underdiagnosed. Abuse is often a factor causing women's mental health. Treatment needs to be reflective of the type of situation or experiences had, and also needs to be respectful of gender differences. Another example, women tend or traditionally have tended to be the caretaker of the family and the home, leading to a buildup of stress and a feeling of loneliness being the only caretaker. Now more than ever, there are more women in the workforce, and they are still expected to maintain the family and the home, which would contribute even more to these feelings previously discussed. Social support from friends, family, and the community can help diminish or decrease these feelings.
I think one of the largest healthcare concerns currently in our area is a lack of access to mental health facilities, even though we are a suburb of a large metropolitan area. I think mental health departments are limited in what they can actually bill for, and money is unfortunately the bottom line for most healthcare organizations, so they are closing their doors.
These two women are from the Hudson area, where we are only 10 minutes away from 5 various hospitals and about 25 minutes away from 20 hospitals, and we still do not have adequate mental health care. You can see how this would be very frustrating.
In my residential and surrounding area, I feel healthcare for mental illness is limited, along with the education of it. The closest inpatient mental health facility is in Minnesota or at the complete opposite side of the state. A lot of times I see mobile crisis be contacted, then that representative come and make a safety plan with the patient, then that patient just gets discharged. Sometimes this method is effective, but more times than not, we'll see the same patient again regarding the same issue because the safety plan has failed. Being an RN at a hospital in a suburb of the Twin Cities, more resources should be readily available.
The mental health resources and health care is really lacking in our area. Because we are in Wisconsin, it gets tricky when trying to work with Minnesota for our mental health patients. If a patient needs to utilize an inpatient facility, it often results in a 4-hour car ride in the back of a squad car. This makes the patient feel like a criminal and may make them regret seeking help in the first place. There needs to be a better system in place to adequately help and care for these patients.
Keeping mental health issues in the forefront and talking about it. 1 in 3 people will have a mental health issue, with rates being much higher for women. It should be one of our top priorities in healthcare, but it is far from it.
I agree that talking about mental health and bringing more awareness to it will hopefully help to bring the issue to the forefront. It is a topic that can be hard to talk about, but the more we do, the easier it may become. Let's hear from some more ladies regarding important women's health issues.
I think the woman's biggest health issue is access to care, whether that be access to providers who know women's health, so gynecologists or obstetricians. There's a lack of female providers, as well as a lot of people might not have their insurance cover that specialty care, so I think a lot of times people aren't getting the care that they need to be healthy as a woman. Like they're not protecting their uterus, or they don't know education regarding what's healthy and what's not. A solution, I think, is increasing funding for programs such as Planned Parenthood or programs that give back to people who may not have insurance or have access to healthcare. Through this, we can increase the amount of people that we see and the amount of women who can help get that healthcare that they need for women's health.
I think one of the biggest things is just lack of insurance and lack of education, because chronic diseases are growing in women in this area and just in Wisconsin and the nation in general. We need to teach more about preventative measures too. Yes and no. I feel that people have lack of access to healthcare, so they're not going in because they don't have that access, and there's not as many providers out there. And I also believe that some of the reasons people aren't seeking help is because of the lifestyle choices that they make. More people are living more sedentary lifestyles, so I think that has something to do with it too. I think another reason why people aren't going in is because they are afraid that they're going to get judged because of their lifestyle choices. For example, if they're smokers or drinkers or make poor decisions or are risky with sexual behaviors, they might feel that they're going to be judged, so they don't go in because they're afraid of what people might say or what they might hear, so they just kind of avoid it to hear that.
Yes, I think that increase in chronic conditions has something to do with access to healthcare. Two chronic conditions that I can think of off the top of my head that really affect women are cardiovascular disease and osteoporosis. I think with an increase to access, we can increase our teaching and health education, and I think that could help decrease osteoporosis and cardiovascular disease by teaching women about diet, nutrition, and exercise to increase bone density and decrease blood pressure and risk for cardiovascular disease. I think a way we can solve this problem about helping women decrease the amount of chronic conditions that they have or women have in general is by increasing the amount of people we reach with testing. I know I've seen osteoporosis vans go around and do bone density scans, but I think if we do this in more rural areas or areas that have greater lack of access to healthcare, that could help increase this, as well as drawing labs and doing blood pressure monitoring for people who have cardiovascular disease and keeping track of people if they're at risk for one of these chronic conditions and following them along on a time frame.
Health promotion and disease prevention consists of learning about one's own health and developing and maintaining healthful behaviors. There is only so much health teaching that can be done if the patient is not willing to listen. Much of disease prevention and health promotion ultimately falls upon the patient. They need to figure out what they want to do with the education and health teaching provided to them, because it is ultimately up to them to decide how they're going to live their life. The two La Crosse hospitals, Gunderson Lutheran and Mayo Clinic Health System, provide care to much of the surrounding area. People travel from up to an hour away to receive their care in La Crosse. Much of the surrounding towns are considered to be rural, so they are limited on the care that they have and get to choose from. In Hudson, there is a surplus of care, so the patients can be more picky about who they choose to get their care from. While we do have many hospitals in a small radius, that does not mean that the health care is any more affordable. As I was thinking about how we could help people who do not easily have access to health care, I thought it would be cool to try and collaborate a pop-up clinic for people in the community. I currently work at Hudson Hospital, and a few other team members from the emergency department were interested in organizing a pop-up clinic or a mini triage clinic in our community. hospital staff collected outdated medical supplies such as syringes, sterile gauze, alcohol wipes, and so on to be used at the clinic. The purpose of the clinic was to address the needs of community members who may not have insurance, are underinsured, or lack appropriate access to health care. This clinic was similar to the clinics set up by our capstone students who went on immersion trips. They triaged clients with various health concerns and referred them appropriately for follow-ups. It would be really cool to see more events like this available to community members. Every year, each hospital has tons and tons of outdated supplies that are not technically appropriate to use in a hospital setting, but also do not need to go to waste. They could be used at clinics like this one in order to reach more community members. Continued success in the women's health movement depends on political commitment, sufficient funds, educated and interested scientific and lay communities, advocacy by professionals, patients, and the public, and involvement of women, men, and communities in working for equality and recognizing gender differences. These factors have driven the explosion in women's health research and are responsible for advances in developed countries and throughout the world.